So I'll turn now to Farzana Chowdhury, who, to give a quick introduction, has launched, Niveda. I know the name, but I can't remember the year it was launched. But in 2014, thank you. Nibedita, which is a really innovative insurance product targeting women in Bangladesh. I will let you speak to it, but I'll just say that we're excited to hear from Farzana to talk about what motivated your company to put a product into the marketplace that was innovative and unlike other things that existed at the time. Thanks.
Thank you. Thank you, Caitlin. Thank you.
Use this one. Sorry.
Thank you, Caitlin. Being an SDG pioneer was kind of a recognition for us, for me, as a women leader, as the first female CEO in this, in our country, in the bank and insurance industry. And of course, it was tough because when you are a woman, you have to work twice as harder than a man to prove your worth. That's the universal truth. So to answer your question, what motivated us? When I first became the CEO, I first thought that this is my core responsibility to come up with something to actually serve the women, right? And also to bring in some products from insurance products for women, which was non-existent in Bangladesh. And Nibedita is a unique concept which actually a first ever comprehensive insurance product in South Asia. The beauty of this insurance service is it is not only an insurance scheme, it is a lifestyle, it is a life savior. That relates to SDG. It's a one-stop service platform for women for improving their life standards, improving to safeguard their uncertainty, security. We have insurance coverage. We have trauma allowance for acid victims, rape victims, and those who are exposed to road bully. There's a mobile app where a woman can only press the panic button to get the police support or law enforcement agency. And not only that, there are other value-added services which she requires, like financial assistance from the banks and financial institutions. Having our policy, that person will get a fast-tracking service in those institutions, in healthcare, in training organization. We have a lot of examples in our country where a factory worker, just an example, a factory worker who actually had an accident and lost her eye, and after settling her claim, she was attacked because she had some claim amount and she was thrown out from her job. And actually, life has fully changed through Nibedita. So this is an ultimate solution for female. It's a one-stop service platform which can change her life. Why we were motivated? Yes, of course, I'm a woman, but when I was looking at the leadership styles, when you work for the SDG, you have to have these objectives embedded in your strategic objectives. In our company's strategic one of the strategic objectives is women empowerment, youth and improving lives. So women empowerment comes not only with with the number. I mean, you were saying that our business opportunity. I fully agree with you. If you talk about only business opportunity, it doesn't really mean that. You have to have a holistic approach to improve lives. If you improve life, that will automatically improve the business performance, the productivity of the worker, and of course, enhance your profits. So this is where the intention is very much needed, where I had that, and of course, I must say our board and our senior management from a top-down, we had a top-down approach, and we started this practice in our office where we had policies for women. Women can come to the top position. Women were given important responsibilities and equal opportunities. Next come the ambitions, of course. Without ambition, an SDG goal, we cannot achieve by 2030. I was an SDG pioneer last year, and I really want to be, and of course a leader, but I want to be an SDG achiever. You know, achiever means we have our internal goals. It has to be embedded in the national goals. Where in Bangladesh we have an SDG office under the Prime Minister's office, which is solely focused to the 17 SDG goals. So this office is working in terms of improving the 7th five-year plan, and of course, to embed the SDG goals in the national goals. So in our country, we have 160 million people. It's a young population, and 50% is women. So to reach out 80 million women is not easy for us, right? So we have our internal goals to reach. We have already reached 20,000 female. We have our internal goals to reach 2 million, and then 10 million. So that is the ambition. Our ambition is to have to reach SDG achiever by 2030, and by achieving this, we need collaboration. Before that, you have consistency. Consistency is one thing. You need to be consistent with what you're working with what you with the activities that you have. Like it is the women empowerment is. Our strategic objective is we work for women from all walks of life in terms of students and students from entrepreneur, professionals, homemaker. So there are a lot of other women in this country who needs this support. And of course, these activities needs to be circulated through advocacy trainings and of course through awareness programs. Then collaboration, of course. If you need to be successful, you need to scale up, right? And for scale up, you need to have partnership agreements, partnership arrangements with governments, with UN agencies, with private sector, like the value-added services that I've mentioned in our Nivedita. We have arrangements with banks, financial institutions, development organizations, and telcos and other multinationals. And we're also working with the ministries. The Prime Minister's office, they have 5,000 digital centers across Bangladesh, through which we will be able to reach out women through these 5,000 female agents. This Nivedita can be given to all women in the country. Not only that, the health ministry, the health product is also embedded in the Nivedita product, so that the wellness of the women is important. And of course, the ICT ministry, where I mentioned that the ecosystem will not be completed without the touch of technology. That's why we have the Nivedita app. So, and lastly comes to accountability. Accountability is, I think, one of the most important aspects of this SDG leadership, that we need to be accountable of what we are doing, and we need to share our experience, we need to share our learnings, we need to engage with our partners organization and have a holistic approach and take it forward and change the lives of the women in a positive manner. So we, at the end, I would like to say that Nivedita is not only a lifesaver, it is the ultimate security and health solution for women. And we want to make it not only in our country, we want to cross the border and replicate this model across the globe. Thank you very much.
Thanks.